Hello, dear students. Good evening, all. I hope you have all enjoyed studying for NEET MDS 2025 examinations. And today we will discuss some important questions and answer discussion on dental anatomy. So let's begin. So first question, the deciduous tooth which does not have any resemblance to other teeth. Is it maxillary first molar or mandibular first molar, maxillary second molar or mandibular canine? So let's go to discussion part. So the primary maxillary first molar which resembles the premolars. Then maxillary second molar resembles maxillary first molar. Mandibular second molar resembles mandibular first molar. But the primary mandibular first molar which does not resemble any of the permanent tooth. So it is the answer. So primary mandibular first molar is the answer. It does not resemble any of the permanent tooth. Largest mesiodistal diameter in the primary dentition is mandibular first molar, mandibular second molar, maxillary first molar, maxillary second molar. So largest mesiodistal diameter in primary dentition is mandibular second molar, and the largest buccolingual diameter in primary dentition is mandibular second molar. So largest mesiodistal diameter is mandibular second molar. And buccolingual diameter, largest one is for maxillary second molar. Okay, so the mnemonic is MD for MD, that is mesiodistal diameter largest for mandibular second molar. Okay, so the answer for this one is mandibular second molar. Resorption of incisor canine during shedding occur in which direction? Is it apical or and lingual direction, apical and buccal direction? Depends on the root angulation and it is not specific. So exfoliation, which occurs 2 to 3 years after deciduous root is completely formed. And here this is the exfoliated deciduous canine teeth. These are the exfoliated deciduous incisors and these are the exfoliated deciduous incisors. So these are the incisors and these are the canine teeth. So exfoliation which occurs after 2 to 3 years, that root is completely formed. And root begins to dissolve, root which will resorb at its apical end and continues in the coronal direction. And the follicles of the developing incisors and canines are in a position lingual to the deciduous roots, hence the resorption takes place in apical and lingual direction. So these are the deciduous molar roots completely resorb. Here this is the enamel of a premolar and this is the formation of new bone. Here this is the contact between deciduous and permanent tooth and this is the bone resorption. So the answer is resorption of incisor and canine during shedding occur in apical and lingual direction. The distinguishing character of a particular tooth in one group is set trait, type trait, then arch trait or class trait. So what is a trait? So what is a trait? It is a distinguishing character of quality or peculiarity of tooth or group of teeth of an arch or set of teeth, and it is named accordingly. So first one is a type trait. What is a type trait? It is a distinguishing character or quality or peculiarity of particular tooth in one group. So if it is a peculiarity or a quality of one group of teeth, okay, that is a particular tooth in one group. So here this is the type trait, a particular tooth in one group is type trait. So example is the feature between permanent maxillary central and lateral incisors. So feature between central incisor and lateral incisor. This is the type trait. Okay. Then what is the class trait? It's a distinguishing character or quality of a class or group of teeth. So here class or group of teeth. So here the examples are incisors, canines, premolars, and molars. So next is arch trait. This is a character or a peculiarity of teeth of maxillary or mandibular arch. So it is based on arch. So maxillary or mandibular arch. Okay. And the examples are all maxillary molars have oblique ridge on the occlusal aspect. So that is maxillary molar having oblique ridge. Then next is the set trait. Here, this is the distinguished quality or peculiarity of either deciduous or permanent dentition. So either it is for primary or permanent dentition. This is the set trait. So the example is all permanent teeth are larger than deciduous teeth. So these are the various traits. What is a trait? It is a distinguishing character or quality or character of quality or peculiarity of a tooth or group of teeth of an arch or set of teeth. Type trait, it is particular character of a particular tooth in one group. Example, central incisors and lateral incisors. Class trait, it is a character for a class or a group of teeth, that is incisors, canines, molars, and premolars. And arch trait is maxillary or mandibular arch. So oblique ridges are present in maxillary arch. And set trait is so primary or permanent dentition. All the permanent teeth are larger than the primary teeth. So these are the various traits. So here a particular tooth in one group is type trait. Okay. Coming to the next question. Mathematical formula of human dentition resemble which curve? Is it alpha or beta or gamma or catenary? So McConnell and Kerr, the catenary curve in dentistry, which refers to shape of a dental arch, specifically lower or mandibular arch, and is used as a visual guide for initial placement and arrangement of the artificial teeth, particularly in conjunction with removal of fixed prosthetics and CAD/CAM technology. So this is the catenary curve. This red color curve is the catenary curve. Okay. And this is the shape of a dental arch. So the answer is catenary curve. Permanent tooth showing least variability in the eruption time is this maxillary canine or first premolar or second premolar or mandibular incisors. So coming to discussion part, eruption time of permanent teeth which varies from tooth to tooth. According to Gahn, teeth with lowest amount of variation in eruption time are mandibular incisors, as 90% of mandibular incisors will erupt within a span of 3 years. And eruption time varies most for mandibular second molars with a span of 6.5 years. So the answer for the question is mandibular incisors showing least variability in the eruption time. Coming to haplodont. What is haplodont? Is it 3 cusp in a line or 4 cusp in a line or single conform tooth or 3 cusp in a triangle? So there are 4 phylogenetic classes of tooth forms. First one is the single cone or it is known as haplodont. So haplodont is single cone form teeth. And it is represented schematically by the simplest form of the tooth, that is single cone. And this type includes many teeth in both jaws and seen where jaw movements are limited to simple open and close movements. And their main function is procurement of the food. Okay. Then next one is the triconodont. So this is the triconodont. Here it exhibits 3 cusps in line. So here this is the single conform tooth. This is the 3 cusp in a line. So 1, 2, 3. Okay. 3 cusp in a line. in posterior teeth with the largest cusp centered with a smaller cusp located anteriorly and another posteriorly. So here this is the largest cusp which is centered and anterior and posterior cusp are there. So purely triconal dentations are not seen, although certain breeds of dogs and other carnivores have teeth reflecting the triconal dot form. Next one is the more efficient three-cornered tritubercular. This is the tritubercular molar arrangement. Here, this is consistent with the teeth bypassing each other more or less when the jaw is open or closed. So this is a tritubercular arrangement. So this is a tritubercular arrangement, and this is the more efficient three-cornered molar arrangement. And next, this is the quadritubercular class or quadritubercular arrangement. It reflects an occlusal contact relationship between teeth of upper and lower jaws. Articulation of jaws and teeth is consistent with the jaw movements and functions of these classes of teeth. So this is the quadritubercular molar form. Okay. So these are the haplodont, single conform tooth. This is the triconodont, three cuspine line. This is a tritubercular form. Here, this is a more efficient form and three cusp in a triangle. And here, this is the four cusp in a quadrangle or quadritubercular molar. Okay. So the answer for haplodont is single conform tooth. So coming to that, the type of question which asked, identify the stage of tooth development. So keeping all these in mind, you can answer this question. Okay, that is it haplodont or triconodont or tritubercular or quadritubercular? Which one is the answer? It is tritubercular, and it is a more efficient molar pattern. That is three cusp in a triangle. That's tritubercular type. Okay, so this is the haplodont, this is a triconodont, and this is a tritubercular class, and this is the quadritubercular class. Okay, so our answer is tritubercular. Okay, smallest cusp in mandibular first molar. Is it mesial-buccal or cusp of Carabelli, or distal cusp or distobuccal? So the permanent mandibular first molar, which shows five cusps. Which are they? This is the mesial side and this is the distal side. So mesio-buccal is the largest and longest cusp, and followed by mesiolingual. This is the mesiolingual. This is the mesiobuccal. Okay. Then distolingual. Distolingual is the next one. Okay. Then distobuccal. This is the distobuccal, and this is the distal. So distobuccal, then distal. So distal is the smallest cusp, and mesiobuccal is the largest cusp. Okay, this is the smallest cusp. So the answer is distal cusp. So distal cusp is the smallest cusp in mandibular first molar. Cusp of Carabelli is present in mesiobuccal cusp of first molar distally, or mesiolingual cusp of first molar lingually, or distolingual cusp of first molar lingually, or distobuccal cusp of first molar lingually. So what is the answer? So this is the cusp of Carabelli, and this is the maxillary first molar. Okay. So in which side the cusp of Carabelli is seen? It is the lingual side, and it is the mesial side. So mesiolingual cusp of first molar lingually. This is the answer. Okay. And it is asked in another way, that is, it is present on the permanent maxillary molar in which position? That is mesial half of the palatal surface. Is the answer. Okay. Coming to oblique ridges formed by. It is seen in maxillary first molar, oblique ridge. So it is formed by, so here this is the cusp of Carabelli. So cusp of Carabelli is also seen in maxillary first molar. So it is a zoomed version. Here this is the cusp of Carabelli. Okay, but here our question is oblique ridge. This is the oblique ridge. Okay, so oblique ridge is seen where this is the distal area and this is the, here this is the distal area and this is the mesial. So here this is the mesial and this is the distal. So distal, buccal and mesio-lingual. So the answer is mesio-lingual or mesio-palatal and distobuccal cusp. So oblique ridge is formed by mesio-palatal and distobuccal cusp. So next question, opening of Stensen's duct is opposite to. Is it upper second molar or lower second molar or upper second premolar or upper first molar? So what is the Stensen's duct? Stensen's duct is the duct for parotid gland. This is the Stensen's duct. Okay. Then what is for a submandibular gland? Submandibular gland is known as the Warten's duct. Okay. And sublingual gland is the Bartholin's duct. So these are the various ducts for various glands. So parotid gland, here the Stensen's duct which opens near the maxillary second molar. Okay, so upper second molar, that is parotid gland and this Stensen's duct. So upper second molar, this is the upper second molar. Okay, here is the Stensen's duct. So opening is near the upper second molar. Then Warten's duct is for the submandibular gland. Where it is open? It opens at the side of the lingual frenum or carunculum sublingualis. So Warten's duct opens to side of lingual frenum. Then sublingual gland, that is Bartholin's duct, it opens near the submandibular duct. So here this is the submandibular. Okay, so Bartholin's duct, it opens near the submandibular duct. And several minor ducts are so there. It open along the sublingual fold independently. So these are the various glands and ducts. Okay, so parotid gland, which opening of Stensen's duct is opposite to second upper molar. Which index correlates the maturational status of a tooth to its developmental stage? Demerjan index or Shore or Masler, Gustafson or root transparency. And this is the Demerjan's method. This is one of the simplest, most practical and widely employed methods to predict age and maturation in children and adolescents, probably due to detailed description and radiographic illustrations of tooth developmental stages, as well as its relative simplicity. So, it assesses mandibular left side teeth from central incisor to second molar. Third molar is excluded. Okay. And this is the Shore and Masler's pictorial representation of teeth development. Here, scientific dental age estimation, it describes 20 chronological stages of tooth development starting from 5 months intrauterine life until 21 years of age. This chart is based on histological sections and permit direct comparison with the radiograms. And this is the Gustafson's method. Here, this is the age estimation based on certain morphological and histological changes of the teeth. And here, this method assists regressive changes such as accretion, secondary dentin deposition, loss of periodontal attachment, cementum apposition at the root apex, root resorption at the apex and dentin translucence. So coming to the root dentin translucency, here this is the degree of transparency in the root dentin. It is a reliable method for estimating age, particularly in forensic context, as it undergoes measurable age-dependent morphological changes. So the answer for this question, that is, which index correlates the maturational status of a tooth to its developmental stage, is Demerjan index. So all the 8 primary anteriors are erupted in children by the age of, is it 14 to 16 months or 8 to 12 months, 10 to 14, and 6 to 8 months? So here this is the primary teeth chronology. Here the question is about 8 anterior teeth, that is upper 2 central incisors, 2 lateral incisors, lower 2 central incisors and 2 lateral incisors. So upper central incisor and lateral incisor, it is 9 to 13 months. Lower central incisor and lateral incisor, it is 10 to 16 months. So central incisor lower 6 to 10 months, lateral incisor 10 to 16 months. Okay. And upper central incisor 8 to 12 months and lateral incisor 9 to 13 months. So it is roughly 14 to 16 months. So next question, how many cusps does the crown of maxillary first primary molar have? Is it 2, 3, 4 or 5? So for first primary molar, and it is maxillary. So the answer is 4 cusps for the maxillary first primary molar and 5 cusps for the second molar. Okay. So next question, number of teeth seen on X-ray at birth? 20, 22, 24 or 30? So this is an X-ray at birth. Okay, so at birth all the deciduous teeth are seen. So all the deciduous teeth, that is 20. Okay, plus permanent first molars. Which are they? Yeah, 1, 2, 3, 4. So plus 4, that is 24 teeth are seen on the X-ray at birth. So tooth with the smallest root is maxillary central incisor or maxillary lateral incisor, mandibular lateral incisor or mandibular central incisor. So the answer is mandibular central incisor. The linear curve which runs in anteroposterior direction is curve of Spee or curve of Monson, curve of Wilson or curve of anti-Monson. This is the curve of Spee. Here this is the curve of Spee and it is a natural curve, anatomical curvature of the mandibular occlusal plane running from incisal edges of the anterior teeth to the buccal cusp tips of the posterior teeth, and it is important for efficient mastication and tooth alignment. Whereas this is the curve of Wilson and this is a mediolateral occlusal curve. So curve of Spee is the anteroposterior curve. So the answer is curve of Spee. Gubernacular cord guide the eruption of permanent teeth, primary teeth, both and none. Gubernacular cord guide the eruption of, so the answer is permanent teeth. So these are the gubernacular canals. And here this is the deciduous tooth, this is the gubernacular canal and its contents, and this is the developing permanent tooth. So this cord which guide the eruption of permanent teeth. Okay, not the primary teeth. This is very important. Okay. So what is the Y pattern? Dryopithecus pattern. It refers to arrangement of grooves on the occlusal surface, that is chewing surface of the mandibular first molar. That is the Dryopithecus pattern or Y pattern. Here, union of mesiolingual and distobuccal cusp along the floor of central fossa is called Dryopithecus pattern. And the key features are 5 cusps are there, 5 major cusps around the projections on a tooth, Y shape, 2 deep transverse grooves converge to form inverted Y or V shape on the crown. In conservative pattern, the Y pattern is considered more primitive or conservative pattern compared to the plus pattern, which is considered more evolved. And which of the following permanent tooth is first to calcify? Maxillary permanent first molar or mandibular permanent first molar or maxillary or mandibular central incisor? So the answer is maxillary permanent first molar. So these are the some of the important notes, that is types of dentitions. Which are they? First one is the monophyodont, diphyodont or polyphyodont. So mono means one. So it represents presence of only one set of dentition for the entire life. That is monophyodont. What is di? Di means two. So human beings are diphyodonts. It's very important. It has the common key exam. Okay, so the presence of two sets of dentition in diphyodont. And polyphyodont. Poly means more than two sets of dentition. So this is the first type, that is monophyodont, diphyodont or polyphyodont. Then what is homodont or heterodont? Homo means same. So all the teeth have same shape without distinction such as incisors, canines, premolars and molars. And hetero means different groups of teeth. Then next is the bunodont. What is bunodont? It is primitive type of teeth seen in primates like cats, dogs, etc. And here it contains simple conical cusp. Then next is haplodont, triconodont, tritubercular and quadritubercular stage. What is haplodont? Here this is the simplest conform of teeth with single root. It was asked in Ames exam, and it is seen in reptiles like crocodiles. Only simple hinge movements of jaws are seen. And triconodont is seen in early mammals. As the name suggests, its three cusps are arranged in a line with largest cusp in the center. In tritubercular stage, three cusps are arranged in a triangle form. And quadritubercular stage, fourth cusp is formed and occlusal contact relationship between upper and lower jaw is established. The longest tooth in oral cavity is maxillary canine. That is 10 plus 17 mm, and mandibular canine 11 plus 15 mm. So in mandible it is mandibular canine, and it is in maxillary canine. So the longest tooth in oral cavity is canine. Then longest crown in maxillary arch is central incisor 10.5 mm. Longest crown in mandibular arch is mandibular canine, that is 11 mm. Maximum root length in maxillary arch or longest root in oral cavity is maxillary canine. Maximum root length in mandibular arch is also canine, that is for mandibular canine 16 mm. Then next is shortest tooth of the dentition or shortest tooth in maxillary arch is maxillary second molar. So maxillary second molar is the shortest tooth in maxillary arch, and in mandibular arch it is second molar. Then shortest crown in dentition or shortest crown in maxillary arch it is maxillary second molar, and in mandibular arch it is second molar. The shortest root in maxillary arch it is maxillary second molar, and shortest root in mandibular arch it is central incisor. So shortest root in mandibular arch is central incisor. Okay, all other answer is second molar. Largest mesiodistal diameter of crown in anteriors is maxillary central incisor. Largest mesiodistal diameter of crown in oral cavity is mandibular first molar. Okay, it is mandibular first molar. Then largest labiolingual diameter in anteriors it is maxillary canine, and in oral cavity it is maxillary first molar. Okay, so largest mesiodistal diameter of crown in oral cavity is mandibular first molar, and maxillary first molar is largest buccolingual diameter, that is maxillary first molar. Then posterior tooth with longest root is palatal root of maxillary first molar. Posterior then largest mesiodistal diameter in primary dentition is mandibular second molar, and the largest buccolingual diameter in primary dentition is maxillary second molar. Then shape of the occlusal surface of some teeth. Permanent maxillary first premolar, it is hexagonal. Permanent mandibular first premolar, it is diamond. Second premolar, it is square. Maxillary first molar, rhomboidal. Maxillary second molar is also rhomboidal. Then permanent maxillary second molar, rhomboidal with more obtuse angles. Maxillary third molar is heart shape. First molar is hexagonal or trapezoidal, and maxillary first molar is triangular. How many lobes are there for this tooth? For permanent incisors, canines and premolars, there are 4 lobes. 3 cusp type, that is mandibular second premolar, that is 5. Permanent maxillary first molar, and for mandibular first molar it is 5. And for primary maxillary second molar and primary mandibular second molar also 5. In other permanent molars it is 4, and primary incisor only 1 lobe is there. First permanent molar is located in the center of fully developed adult jaw anteroposteriorly, and they are called cornerstones of dental arches. And what are corner teeth? Corner teeth is nothing but it is canine, which help to form a foundation for normal facial expression at the corners of the mouth. Permanent maxillary first molar contains two major fossa, that is central and distal fossa, two minor fossa, distal and mesial triangular, five developmental grooves are there, one oblique ridge and four cusp ridges. Permanent mandibular first molar contains one major fossa, that is central fossa, two minor fossa, that is mesial and distal triangular, four developmental grooves and five cusp ridges. And what is the outline form for these cervical cross sections? Maxillary first premolar, it is kidney shape. Maxillary second premolar, ovoid. Maxillary first molar, rhomboidal. And mandibular first molar, it is quadrilateral. In normal occlusion, mesiobuccal cusp of maxillary first molar occludes in mesiobuccal groove of lower molars. Distal buccal cusp of upper molars occlude with the distal buccal groove of lower molars. Mesiolingual cusp of upper molars occludes with central fossa of lower molars. And distal lingual cusp of upper molars occludes in the distal triangular fossa and distal marginal ridge of same namesake molars and mesial marginal ridge of molars distal to the namesake. So molar relationship 1 and 2 is often referred to as key of occlusion. So that's all about the oral anatomy questions and answer discussions. So see you on next video. Happy studying. Bye for now.